All right, here's a scenario for you. A 60-year-old man has been extremely fatigued and experiencing some unexplained weight loss. So concerned, he schedules an appointment with his doctor, but his doctor's response is dismissive as he's told, it's natural to feel tired, and as you age, you're probably just not getting enough rest, but this is also part of getting older. Try getting more sleep and drinking some more water and see if this helps. Now, he's leaving really frustrated. His concerns were brushed off, and he's unsure of the next steps. So this is an all too common scenario with the aging and chronically ill population. So let's talk about medical gaslighting. So this storyline shows how health providers undermine patients' experiences and fail to take their symptoms seriously. So this dismissive attitude and lack of investigation can leave patients feeling unheard, discouraged, and uncertain about their health concerns. So this can ultimately be dangerous with certain conditions. Here's another common occurrence. Emily's a 25-year-old woman who's been living with a chronic autoimmune condition for many years. And she's been managing her symptoms with medication and regular visits. However, recently she's noticed a significant increase in her pain and stiffness in her joints. So, concerned, she schedules another appointment. She explains her new symptoms and how they're impacting her quality of life. However, her doctor dismisses her concerns, saying, well, your blood work looks fine, and these symptoms aren't common with your condition. It's probably just temporary. You've been fine on the current medication, so try not to focus on it too much. She feels pretty frustrated and invalidated because she knows her body and the patterns of her illness, but again, disregarded. So this leads to feeling really discouraged, unchecked symptom escalation, a sense of helplessness, and potential hospitalization due to worsening of symptoms that could have been avoided. So in this scenario, the doctor fails to acknowledge the patient's lived experience and assumes that the symptoms can't be valid because they don't fit into the typical presentation of the particular condition. Medical gaslighting refers to a phenomena in which patients' symptoms and concerns or experiences are dismissed or undermined by healthcare providers. It occurs when doctors or other medical professionals, and let me interject something here.
Okay.
Throughout this video, I'll refer to doctors, but this is really any health professional who's in a position of authority and is supposed to be partnering with their patients regarding their care. So this can be a doctor, an RN, a nurse practitioner, or a physician's assistant, even a physical therapist or a nursing assistant. So downplaying or discrediting a patient's complaints leads them to doubt their own experiences or question the validity of their symptoms. And the term gaslighting has become much more recognized in the past several years and is originally derived from the 1938 play called Gaslight, where a manipulative husband tries to convince his wife that she's gone insane by making her doubt her own perceptions of reality.
Don't you giggle so much. Behave yourself.
It may have fallen behind the dressing table. Let's talk this over between ourselves. Please, please.
So what he does is he dims the gas lights in their house, which causes them to flicker, and then convinces her that the flickering is a figment of her imagination. He also hides and moves objects and then claims that she must have misplaced them.
Which was the room above yours, Mrs. Mellon?
The footsteps.
What footsteps?
The gas slide going up and down.
Over time, her mental state deteriorates and she becomes dependent on her husband for stability and guidance. So if you like old movies, I highly recommend that you watch this. In general, it refers to a form of psychological manipulation in which a person or a group covertly sows seeds of doubt in a targeted individual, making them question their own memory, perception, and judgment. So Anyone who's had the bad fortune of dealing with a narcissist, for example, or has been the victim of emotional abuse, knows that this is one of the tools in their arsenal that they use, and it is extremely damaging on many levels and can take years to recover from. Similarly, medical gaslighting causes the same confusion, frustration, and despair when health complaints aren't given sufficient consideration by a trusted healthcare provider. And it can take various forms. The first would be minimizing symptoms. So health providers that downplay the severity of a patient's symptoms by making them feel like their concerns are unwarranted or exaggerated. For instance, a doctor might dismiss chronic pain as something just in their head, or attribute fatigue to mere stress, or even assume that someone is drug seeking. Blaming mental health issues is also another way of gaslighting. So patients presenting with physical symptoms are sometimes wrongly attributed solely to mental health conditions such as anxiety and depression, implying that their symptoms are imaginary. So while mental health can certainly influence physical well-being, we all know this, it's essential to investigate and address physical symptoms independently. The next is dismissing or trivializing concerns, which is where a thorough investigation or testing is just not completed. It's not even considered. And this behavior can undermine trust and deter patients from seeking further medical help. The other massive issue with this is this will cause people to hop from doctor to doctor, hoping to finally stumble on somebody who takes them seriously. This is costly, time-consuming, and this can be a huge burden for not only the patient, but also our healthcare system. And then the last is delaying or denying treatment. So another situation is when a provider hesitates to provide necessary diagnostic tests or referral to specialists. This delay can have serious consequences, particularly for conditions that require early intervention like myasthenia gravis. So the consequences of medical gaslighting can be significant. It can lead to delayed diagnoses, inadequate treatment, unnecessary suffering, and then worsening of medical conditions. It can also have a profound psychological effect, causing patients to feel invalidated or even embarrassed that they're being accused of being a hypochondriac. It's important to note that medical gaslighting is not exclusive to a particular gender, age group, or condition. However, certain groups such as women, people of color, individuals with chronic illnesses, and those with mental health issues are way more susceptible due to systemic biases and stereotypes that exist. So the chronic illnesses that I've seen this the most with include POTS or postural orthostatic tachycardia syndrome, fibromyalgia, mast cell activation, which is where someone experiences repeated episodes of the symptoms of anaphylaxis, like hives or swelling or low blood pressure and difficulty breathing. And then rounding out this list is myalgia and chronic fatigue. And now that I think of it, probably the most disturbing example of medical gaslighting is what went on with women that were depressed and anxious in the early 19th century. So everyone's heard of a hysterectomy, right? A hysterectomy is a well-known and accepted term for the surgical removal of the female reproductive organs. But the origin of this term comes from the Latin hystericus, meaning of the womb. This was a condition thought to be exclusive to women, sending them uncontrollably and neurotically insane, owing this to a dysfunctional uterus. So the way to cure this was to just remove it.
Of course it was.
And this procedure is still called a hysterectomy today.
Of course it is.
Now, to address medical gaslighting, patients should advocate for themselves by seeking second opinions, educating themselves about their symptoms and conditions, and finding healthcare providers who genuinely listen and respect their concerns. Healthcare systems and providers must prioritize patient-centered care, effective communication, and empathy to ensure patients feel heard and receive the appropriate care that they need. Sometimes this is easier said than done. So this is one of the main drivers behind Lucid Med. I speak with chronic disease patients every single day who have gone on for years, some of them suffering, but didn't give up when time after time they were dismissed or the testing failed to show anything concrete. And therefore they were met with shrugged shoulders and I don't know what you have. Let's try on some steroids. So I've had myositis patients who went years without knowing what was causing their pain and weakness and only had a single lab value come up as abnormal. So if you're ever experiencing this or know somebody who has, drop a comment and let me know. The more attention we bring to this issue, the better off we all are. Never stop advocating for yourself or your loved ones. It is of the utmost importance. So that's going to do it. I'm Danielle Minetti, and this has been Lucid Med. So if you learned something cool or found this video helpful, like, comment, subscribe, share. All of it helps. And even though I sound like a broken record, it really goes such a long way. And if you'd like to support the channel, check out our Patreon or grab something from our store. By the way, it's Sjogren's Syndrome Month, which is our chronic disease spotlight. This is a perfect example of a condition that goes largely unchecked usually because the symptoms aren't always clear and they can often mimic other diseases or just run-of-the-mill dry eye or dry mouth. Also, later this month, I'll be doing a video with one of my colleagues who specializes in small fiber neuropathy. So I hope to see you there once that's released. I upload every Sunday and I truly, truly appreciate all of you. Stay healthy and lucid.